Now, although the WHO Afro region was certified polio-free in 2020, Kenya has confirmed another 5 cases. And the country is currently responding to this outbreak. The investigation team, again, have identified the suboptimal routine immunization coverage in both the host communities and among new arrivals in Kakuma refugee camp, with the majority of affected being the children aged 0 to 5 years. We are talking about Kakuma refugee camp, where probably most of these people are not Kenyans. And because of the congestion within the reception centers, this has exacerbated poor sanitation conditions both within the centers and also in the surrounding. I know we are running with a campaign for Epuka Uchafu Afya Nyumbani. This is the time. And I have said this many times, that Kenya is not a failed public health state, that we have to rise up to ensure that we do the job ourselves. Basic issues to do with hand washing, basic issues to do with sanitation, having a toilet, having a latrine in your compound, basic issues. And the basic issue this week is registration to Social Health Insurance Fund, to Social Health Authority, registering with Social Health Authority for Social Health Insurance Fund, because this is the way to go. Should you not curb all these issues at the household, then you will need to visit a health facility for treatment. How do you get treated when you will not have your social health insurance card? It is important that this week we register and register in large numbers. Kenya insurance cover was taking only 20% of our sales. It is the high time we roll it out to 100%. And this is possible, up to and including Linda Mama, where our mothers will be delivering for free, ensuring that they receive antenatal care and postnatal care, and Edu Afya, where our children will be safe in school. Following the confirmation of what is happening at Kakuma, the Ministry of Health has alerted all high-risk counties to remain vigilant. And it is important with a particular focus on counties in Western Kenya due to the detection of type 2 polio in Bale district, Uganda, with Bungoma borders, which borders Bungoma County. The detection of a positive case in Kamukunji sub-county further heightens the risk of polio transmission in Nairobi and its surroundings. And since the confirmation of this outbreak, several activities have been initiated. An alert has been issued to all the counties, and this is to enhance surveillance through active case searches. And Public Health Emergency Operations Center at both the national and county levels have been activated to coordinate preparedness and response efforts with technical committees, operational at both levels, to ensure comprehensive coordination. Remember, we cannot work alone. You will not work alone as an independent agency. That is why every time there is an issue at the Ministry of Health, we always set up a coordinated effort with all stakeholders in place, because each one of us, you have something to put in, to bring on the table. Therefore, an accosted plan is under development. We will be sharing the same with the nation. The preparation for the polio vaccination that will take place from the 2nd of October to the 6th of October. It is important to note that the upcoming supplementary immunization activity aims to reach a culminative total of 3,843,275 children. And this includes the 2,021,663 children under the age of 10 years and 1.8 children under the age of 5 years in the 9 high-risk counties. That includes Busia, Bungoma, Trans Nzoia, West Pokot, Turkana, and others. The entire of Nairobi, again, children below the age of 5 years, the entire of Nairobi and selected sub-counties in Kiambu, that is Kabete, Kikuyu, Kiambaa, Kiambu Town, Juja, Ruiru, and Thika, as well as Machakos again, where we have Matungulu, Kangundo, Mavoko, and Kajiado counties, where we have Kajiado East and Kajiado North. Risk communication, which is very, very important, starts from here. Who are you going to talk to? What are you going to tell them about polio outbreak in Kenya? What are you going to tell them on what they need to do before these strikes? Starts from here, and there are many other medium of communication that can be useful for this kind of campaign. So we urge parents and caregivers in the above areas, in the areas that I've mentioned, that the campaign will take place in those areas to ensure their children are vaccinated during the polio campaign. And this will go hand in hand with the registration of social health insurance, because this is from household to household. Therefore, when you see the polio campaign, our CHPs giving the doses, it is important to equally take time and register for social health insurance. Now, since the inception of the immunization program has assisted in addressing key killer diseases for children under the age of 5 years, recognizing that vaccination has been one of the most successful and cost-effective public health interventions. The State Department for Public Health is working to ensure that the immunization services offered in the country are highly quality, and they are available, they are acceptable, they are accessible, and they are affordable to all Kenyans at all levels. And for this to be achieved, it is important that communities get more involved in the planning, implementation, monitoring of immunization services. The role of the community health promoters. I have said many times that the community health promoters are a team in health that are helping us to reduce the queues in those hospitals. Communicate to the people at the bottom of the pyramid the need for following immunization, vaccinations for our children, and ensure that they are receiving the right doses and at the right time. Already, our community health promoters, they have identified about 229 pregnant women, and 96,000 of them of the identified women have been referred to a health facility for further assessment and guidance during their antenatal and prenatal care. Again, for children below 5 years, 4,420,000. These children have been assessed for common childhood illnesses, including malnutrition, diarrhea, malaria, and pneumonia. And of course, after assessment, if there is anything that needs to be handled by a professional, they are referred to the health facility. These are not just numbers. But these are numbers that indicate that there are underlying issues at the bottom of the pyramid that need to be addressed. And they cannot be addressed from our offices. They will be addressed by us going from household to household and getting to feel what exactly are Kenyans going through. In terms of hypertension and diabetes, 5.9 million people, over 5.9 million people, they have been screened for diabetes. And out of these, over 100,000 have been referred to a health facility for further testing and management. Over 4 million people have been screened for hypertension, and out of these, 295 and more, because this could be data for yesterday, and more have been referred to a health facility for further assessment and management. Ladies and gentlemen, it is the high time that we gave a directive that when we have meetings like this, we must have a CHP here or a health practitioner for basic checkup. Check your blood pressure, your blood sugar. We could be walking patients and we do not know. And many Kenyans today are dying, one, of misdiagnosis, and two, for late detection of diseases. So you get that you have cancer, it is at the late stages, there is nothing that can be done. But we can prevent this. We can do this. Our going back to what that means, if you look at the three funds that we have under Social Health Authority, we have the Primary Health Care Fund, we have the Social Health Insurance Fund, and we have the Accident Chronic Illness Fund. And all these funds are going to take care of us should something happen. And one of the critical areas that you need to know is screening is part and parcel of what we are rolling out. Therefore, don't stay at home and say, I do not have money. Please walk into the health facility, get screened. Get to know what is ailing you before it gets too late. Mpox. I would do a lot of, I will not do a lot of justice if I live here, if I've not spoken about mpox. Ladies and gentlemen, yes, mpox is here with us. And let us not look at this disease simply because we have 8 confirmed cases and you say that it is not going to get to you. You do not know. But we have a way how to prevent. Already, from the ministry's point, we have done our level best, and in collaboration with many stakeholders, we have set up a task force that is looking into the holistic way of how to handle this disease. A task force that is involving development partners, financial institutions, private sector, and equally other state departments, including the State Department of Internal Security, State Department of Devolution, State Department for Transport, State Department of Immigration, and many others, State Department of Livestock. We have brought all these people together to ensure that we are getting it right. We have enhanced our surveillance of the border, and we have also enhanced our screening, that no traveler will pass our border without being checked. Already we have 8 confirmed cases. We had 5 for quite a while, but last week we added 3 others. We will keep giving you information around the same, and should you have any inquiries or you have a suspected mpox case, it would be important follow through with the hotline numbers for the ministry, that is 719. Then the second number is 0729 471 414. The third one is 0732 353535. I want to extend my gratitude to every one of you who is here today. I want to extend my gratitude particularly to WHO, UNICEF, Rotary, the Bill and Melinda Gates Foundation, the US CDC, the Kenya Red Cross, and the core group, and many, many other people. This meeting would not have been possible if we did not have you. Collaboration is the way to go. I always say we ride on SDG 17 about partnerships and collaboration. It is the high time that we really impact, sustain, and remain visible in all aspects. When we are talking about polio, we need to kick out polio in Kenya. And I reiterate that Kenya is not a failed public health state. We must do the very best. We must do what is required to be done. Thank you very much, and God bless you for the time.